Welcome to our Global Health Conversations. I am with Dr. Cesaltina from Mozambique. She's also the president-elect for AORTIC. Welcome.
Thank you.
To start us off, can you tell us more about yourself and what you do in Mozambique and why you're part of the conversations?
I am Cesaltina Lorenzoni. I am pathologist. I am the head of National Cancer Control Program in Mozambique, and also I am scientific and education director at the biggest hospital in Mozambique.
And cancer is a big issue in Africa, at least in Sub-Saharan Africa. What are some of the challenges you have seen when it comes to cancer and fighting cancer in the continent?
Lack access of health facilities, also the literacy of the people, financial problems, diagnosis at late stage, and also the problem of access of radiation and other type of the treatments.
And as you speak of these challenges, we know that some of the top killer cancers affect women, cervical and breast cancer. Why is that, and why is it so hard to fight those cancers on the continent?
It's very hard because, for instance, cervical cancer is one of the most common cancer in Africa, and also it's the one of with the high mortality. Although cervical cancer is preventable, this is the big challenge. But the woman still have problems in terms of to go to the programs of prevention, to early diagnosis and treatment, and as well access of good technology to do the screening. As for instance, HPV. HPV test, it's still with a high cost in Africa, and very few countries in Africa implemented this program of HPV test. As well, another challenge is the access of the HPV vaccination for girls.
Right, and speaking of cancer, is there a word for cancer in your local language? And if so, what is it?
No, this is one of the challenges, because in our language we didn't have one word to define cancer, but for other disease we have some word to say this is this disease. And the people say, for instance, for breast cancer, they say, I have some problem in my breast. For cervical cancer, I feel some blending. We didn't have specific word, and it's becoming so difficult and sometimes to explain the people what is the disease of cancer.
And what are some of the ways or things that could be done to kind of navigate those challenges, to address them? Because communicating cancer is important in getting people to prevent them.
Yes, for this, we must do expanding our programs also for rural areas, because most of the people lives in rural areas. And also we are trying to translate the documents that we have in our language. It's Portuguese. We are trying to translate it in some dialects language. And one of these challenges also in Mozambique is that we didn't have like only one dialect. We have a lot of dialects. Yeah.
Right. And so in terms again of cancer, what are some of the common stigmas that exist in the community that keep, for example, women from getting screened?
The stigma is about, for instance, if some women they have a breast cancer, they still live the cancer growing because they have a stigma to lose the breast. And also they have a stigma to the partner. You know, the partner, most of time, they do some challenge about the human disease. As well, they have problems to go to the facilities because they are blending, and sometimes they feel like some smells. It's only at those times that they go to the hospital because they are afraid to lose the family as well.
And what are some of the ways that the partnerships that you could have that can be created to support these women, these communities, these patients in Africa? And I say that because oftentimes we think the solutions come from more Western worlds, but what are some of the partnerships that can be built that support local communities?
Yes, we are trying to involve the leaders, community leaders, the midwives, and also the leaders of the some community to bring as well the partner to be part of this problem, to try to resolve that.
And then when it comes to like the global health catalyst, for example, what are some of the collaborations that can be here?
Yes, for global health catalytic, I think that there is this is a big opportunity to collaborate with the AORTIC and with the other countries in terms of programs like education and training programs, in terms of to help us with our voice to other partners. As you know, GHC, there is a strengthening in many partners like NIH, NCI, and the other partners. We can collaborate as well with them. And also one type of collaboration is about the data, and to see also to do also in collaboration some trials in Africa, and to keep that trials led by African people. And I think that this collaborated will be more effective if we implement the C4, and EA will be more cheaper and more available for many of people.
I like that. I like that. So if you were to give advice to people who are trying to fight cancer in Africa, what are some of the best practices or pieces of advice that you can give?
Yes, I can say that the cancer is not the sentence of death. The people must trust on the government, must trust on the personnel, and to go to the facilities, and also to avoid that to go to the late stage of diagnosis. We recommended as well the people go normally to the health facilities to do the screening when we are available.
That is great advice. And to our viewers, I hope you have picked up some nuggets and pieces of advice from our President-elect AORTIC, and she's also the head of the Cancer Control Program in Mozambique. Thank you for being a part of these conversations. Stay tuned for more. But for now, till next time. Thank you for watching.